Hey everyone! Today I'm diving into a cutting-edge topic that's revolutionizing our field: stem cells in periodontal regeneration. You know, periodontal disease can be devastating, leading to tooth loss and impacting overall health. But the future's looking brighter thanks to these tiny powerhouses. So let's talk about how stem cells and growth factors are transforming the way we approach periodontal treatment. Stem cells have this incredible ability to differentiate into various cell types. In dentistry, we're harnessing this potential to regenerate the periodontium. That's the support system of the teeth, including the gums, periodontal ligament, and alveolar bone. One of the key players here are mesenchymal stem cells, or MSCs. These are often derived from sources like bone marrow or dental pulp. When introduced to the periodontal defect, MSCs can differentiate into the specific cell types needed to rebuild the damaged tissues. It's like giving the periodontium a second chance at life. But stem cells don't work alone. Growth factors are crucial in this process. Think of them as the directors of a grand orchestra, guiding stem cells to the right place at the right time. Platelet-derived growth factor, or PDGF, and bone morphogenetic proteins, BMPs, are some big names here. They enhance the proliferation and differentiation of stem cells, ensuring efficient tissue regeneration. Clinical studies have shown promising results. Patients treated with stem cell-based therapies are experiencing better outcomes, with more robust regeneration of periodontal structures. But remember, while the science is advancing rapidly, it's essential to stay updated with the latest research and integrate these techniques responsibly into practice. So there you have it, a glimpse into how stem cells and growth factors are paving the way for groundbreaking advancements in periodontal regeneration. Keep pushing the boundaries, stay curious, and let's continue improving patient care together. Thanks for tuning in.